I'm Caleb Anderson.
I'm Nicholas Chiaverini.
And I'm Harrison Ledger.
We're the Masketeers.
And this is how we are fighting COVID-19.
COVID-19 may very well be the most impactful event so far of the 21st century. There is not a single person in the world that has been able to escape the pandemic. Our group has identified 4 demographics in particular. The first being students, who have lost work experience opportunities and have gained anxiety over the change in learning. The Wollongong homeless community has also been restricted the vital PPE. Frontline workers have had to carry the health and security of Wollongong, and those in aged care have been left in lockdown, and in anxiety of another outbreak. Our group, Caleb, Harry, and myself, Nicholas, formed the Masketeers, an initiative designed to significantly help communities affected by COVID-19. To have effective impact, however, we need to have a good understanding of what to do. One such place we went to was Nowra Hospital.
We surveyed 100 nursing staff members to find out how the COVID-19 pandemic had affected them. We found that the majority of staff members confessed that they had their mental health deteriorate indirectly and directly due to the COVID-19 issue.
Utilising all of this information, we formed 2 different operations. The first was a mask-making initiative. The homeless sector, as previously mentioned, has limited access to PPE, so, to provide support, we made a mask-making class at TIGS. Students can come along and bring fabric, mesh and sewing machines to create reusable 3-layer effective masks to those who need them in large quantities.
Ultimately, this initiative was successful, with 30 mask cutouts being made and some being completed and ready to supply.
As students become more skilled, we expect production to ramp up. The second initiative we had developed was a card-making project. One of our top priorities from the beginning was supporting the mental health of those in the healthcare and aged care sector. We saw an opportunity in allowing for the junior school to write cards of appreciation for each of the staff in Nowra Hospital, along with some of the patients and workers at Opal Aged Care.
Students themselves, particularly in the junior school, have had their mental health negatively impacted by the COVID pandemic. The thing is, we realised that we could connect areas of affected individuals such as students, hospitals and aged care centres together so that we could ultimately uplift and improve the moods of everyone. This is why the card making initiative was so promising and is so promising.
We have also established other key ideas, plans and projects that are currently being implemented and will continue into the future. We have established a plan to connect the Homeless Help Opal Aged Care Facility and organisations that help those in poverty with the TIGS Orchestra Plus Art program, in an effort to create a day out for our student musicians to perform and lift the spirits of this key affected demographic.
The time we are filming this, it's 2021, and the situation in our community in regards to COVID-19 has changed. We haven't had a significant lockdown since March of last year and haven't had a COVID case since December. The economy is steadily rebuilding, and people that lost opportunities due to COVID are now regaining them. Teenagers are getting access to work experience, elders are getting greater freedoms, and we are fundamentally improving and rebuilding our community from the ground up.
However, not everything's smooth sailing. The vaccine rollout in Australia and the Illawarra has been slow. As of April, less than 5% of our population has been vaccinated. Vaccine misinformation has also made patients less confident in the vaccine. Without a vaccinated population herd immunity, our community will still be incredibly vulnerable to another COVID outbreak.
Our team's #1 priority is helping communities affected by COVID-19, and we've concluded the best way to achieve this is to help the vaccine roll out. We've reached out to our contacts in Nowra and Wollongong Hospital once more to find out how we can help in the vaccine rollout. We will also aim to launch a media campaign aimed at targeting vaccine misinformation. We will manage a social media page which will debunk false COVID vaccine news and provide the facts on the jab's safety and effectiveness. We also will employ other measures, focusing inwards towards the local community, such as posters around the city.
We are taking upon ourselves a responsibility usually reserved for government agencies. However, we are prepared to do the job. We've already established connections with local hospitals and have finished the draft of our media campaign. We know what resources we need, and most importantly, we understand how to articulate our ideas to the community.
We believe that we can achieve these ambitions because of our past successes. The mask-making classes and our collaboration with the junior school gave us key experiences and the understanding we need to complete projects of this caliber. While there are limitations to our reach, we believe we can overcome any obstacle with the strength and support of the community behind us. And we know this because we've been working closely with the community to immense success. And we are excited more than ever to be part of those leading the Illawarra through the pandemic.
This is Masketeers, signing off.